Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over a simple and quick routine to decrease knee stiffness and improve range of motion after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos. So the first thing we're actually going to do before we get stretching and doing our range of motion exercises is we want to warm up those muscles, we want to decrease some pain, decrease some stiffness, and promote blood flow. So the way we're going to do that is with a massage gun. And I have here the Bob & Brad M7 Plus massage gun. I really like this. This is a mini massage gun. So it's very durable, easy to use, very small. Just like the other Bob & Brad massage guns, there's different heads that you can use for different purposes. For our purpose today, we're going to use the heated head. So we're just going to use this to massage, decrease pain, decrease some stiffness, and promote some blood flow to all the muscles around the knee joint before doing our stretches and our range of motion activities. So you're just going to go ahead, we're going to turn it on, as well as we want to turn on that heat on the massage head before we go. And you're just going to go, we'll start with the quadriceps, start with your thigh muscles. And we're just going to work through all that muscle belly in your quadriceps, in your thigh. Focusing on about 15 to 30 seconds before, for each muscle group, for each area, and then moving to a new area. So it should take no more than a few minutes to really work out and massage your quadricep, your thigh muscles, all around that knee joint, focusing on those big muscle belly areas. And then once you work through your quadriceps, your thigh muscles, you also want to get underneath and get all the different areas of your hamstrings. Feeling that warmth and that heat, hopefully relaxing the muscles, decreasing some of that stiffness, pain, and discomfort, promoting blood flow to the tissues. So working along the hamstrings as well. Again, working all the different areas. And then as you wrap up, you're also going to get your calf, the muscle belly along your calf. And working all those different areas as well. And just massaging them out. So turn this off a second. So you want to spend a good, 2-3 minutes at least working all the different muscles, your quadriceps, the outside, the lateral part, the inside part. You want to work your hamstrings, the back of the leg, and also work your calf. After you've done that, hopefully everything should feel a little warm, a little loose, a little less stiffness and discomfort. And then from there we can go into our range of motion exercises. So I like to start with the straightening or the extension exercises, but you can start with either one really. And so simple enough from the chair here for knee extension or straightening, there's two different exercises I'll show you. So one, we can do quad sets. So doing quad sets from the chair here, you're just going to put your leg out straight with your heel on the ground. And what you want to do is try to push your knee down toward the ground as you straighten your leg. So you should feel those quadricep muscles of your thigh contract and squeeze. You can hold this either briefly for a few seconds and relax, or you can hold it a little longer, try to get up to 10 seconds even, and then just relax, shake it out a little bit, and then go again. So really trying to emphasize that extension or straightening, pushing the knee down toward the floor, hold it a few seconds, and then relax. Of course, you can also get a small stool or another chair and prop the leg up as well. And it would be the same principles though, just trying to push that knee down, trying to straighten, contract and squeeze the quadricep muscles, hold for a few seconds, and then relax. I like using stretching straps a lot, this green stretching strap. What you can do is, if you put it around your leg, your foot, and then as you do your quadricep set, as you push down, you can give a little pull, pulling your toes toward you, and you'll feel a little bit more intensity. You'll feel a stretch in your hamstrings as you do this as well. Just a little added intensity to the activity, to the exercise. One other extension exercise that we can do from the chair here is knee extensions, or long arc quads, you might hear them referred to. So sitting up in the chair, a little bit, about half or 2/3 of your thigh should be off the chair. And all you're going to do is straighten the leg and come back down. Some common things I see with this is people, one, they want to rush it. They go too fast. We want to go nice and slow. Let those muscles work and contract. And we really want to emphasize that top of the motion, that extension component, where you're trying to get as straight as possible and then bring it back down. The other thing, we want to bring it back down all the way. We don't want to just do this. That's not getting the most benefit. We want to come back to at least about 90 degrees, straighten all the way. You can even hold the top of the motion for a few seconds and then let it come back down. Again, thinking of contracting and squeezing those quadricep muscles each time. If you can get full knee extension to 0 degrees and do about 10 or 15 of these relatively easily, then you can start adding that weight. But don't do that until you really have that full range of motion to perfectly straight or 0 degrees extension. Now for flexion or knee bending, easy exercise to do from a chair here. Sitting forward in the chair still, good posture. You're going to start with your leg out in front of you a little ways, and you're just going to slide your foot back till you get underneath the chair. Just bend back as far as you can. When you get to that limit, hold it for a few seconds, and then let it come back out. It's okay if your heel lifts up, as long as you're getting that bending, that flexion of the knee. You can do a little bit quicker, or you can do prolonged holds. Bring it back, hold for 5-10 seconds, and then relax. You can use the strap for this one, so I like to strap it around my foot, and then put it through both legs of the chair. And you actually can create a little bit of a pulley. So as you bend it, you can pull, give an extra little push or bend, and then relax. You can also use your opposite leg. So as you bend back, push with your opposite leg to add some increased bend or some increased force. And then when you relax, you can actually wrap your foot around the back and use it to help bring it back to the starting position. So that's just a nice simple knee flexion or bending exercise you can do as well. Of course, there's all sorts of knee flexion and bending and straightening range of motion exercises out there. That's just 2 of them. Doing a couple rounds of those couple exercises, especially early on after surgery, can be really beneficial to restoring that knee range of motion, extension, and flexion after surgery. Now we warmed up with the massage gun, and actually what we can do is we can use it as a cool down and for pain management after you do your exercises as well. So we've done our stretches, we've done our range of motion activities. You probably maybe did some other exercises for strengthening or range of motion or stretching. And now we're just going to use that massage gun again, the Bob and Brad M7 Plus mini massage gun. I have that heated massage head again. And we're just going to basically do the same exact thing that we did as we warmed up. We're going to use that massage gun just to promote some blood flow, promote some pain management, some recovery after doing those exercises. And then hopefully that will help you as you go on for the rest of your day, or if it's in the evening getting ready to go to bed, where you have a little bit less discomfort, a little bit less pain and stiffness in the soft tissue and muscles of the knee and around the knee joint. So again, working through the quadriceps, and then you can go down and work through the hamstrings, working all those different areas, 15 to 30 seconds to an area, as well working in the calves as well. So there you have it, real short and simple routine for after knee replacement surgery, decreasing stiffness, pain, and discomfort, working on and improving your knee mobility, range of motion, doing a few stretches, utilizing a massage gun for some blood flow and some pain management. Great opportunity, great options. Be sure I'll put all the information and links in the bio, in the description, for the M7 massage gun, mini massage gun. I really love this, nice and portable, easy to use, easy to take along with you if you're going out of town or if you're not home. Really like this massage gun by Bob and Brad. So thank you very much for watching. As always, please be sure to leave your questions and comments below, and take care.